Hi. I got some positive responses on a previous video, and so here I am again. Um, you encouraged me. Thank you, Julie. I want to speak about some experiences, and this is a bit of a difficult subject matter. But if anything, if I get it out on YouTube, maybe a little bit of a public black eye slash spanking, it might help a few people wise up. I have, sorry, I have a spinal cord injury, so it's a bit tricky. Well, sort of. I'll explain in just a minute, though. But anyway, I'm so glad that as something that I had to say, was because one of the things that people do, with the psychiatric stuff is they get nasty about it, and it's not something that you can help. But everybody at some point, they do have a right to say no, and that's not going into my body. Thank you very much. Um, you know, um, with my gastroparesis, yes, it can be potentially life-threatening. Yeah. If it's allowed to progress, you bet. People wind up on TPN. Total parenteral nutrition is when you have to have, basically what you have to have is a central line IV. And I do actually have one. It's right. They put it way down here because, I guess they think, chicks want the bikini look or something. But at any rate, as for my oils, they're going bloody awesome. This is just so cool. I mean, I'm really excited. This stuff is Zofran. I don't even want to know how much this crap costs. I was at Rite Aid getting something and they handed it to me. I'm like, what do I want this for? Because using my oils, switching to a diet that's gluten-free. I also eliminated dairy and, as a precaution, soy. Now, I'm carrying a bit of a headache right now, but I also have a kind of an infection in my neck, so it's a bit weird. Anyway, in all honesty, I was glad not glad because I wouldn't wish this experience on anyone, but I do want to share, what has happened to me. And Julie, I want to thank you for your encouragement. Now, I realize my situation is extraordinary. And I think as I begin to be able to share some of these things, that it'll help, some people understand that sometimes you do somebody a kindness, and if they're in a situation where it's too traumatic for them to be present, you knock them out. I'm sorry. Sometimes that is appropriate for people. As having been a nurse myself, it isn't that difficult, folks. You give them some freaking out of them, and you grow up. Now, what happened to me started back in June of 1994. I witnessed the Fairchild Air Force Base Hospital shooting. Our survivor site, I'm not going to name it because truthfully, I think sometimes preventing another tragedy is more important. Dr. Park Dietz happens to be right. He's an intelligent guy. And he says, keep that crap off the news. Don't publish the names of the people that did this stuff. And you only discuss the victims, their conditions. You give it a couple minutes of airtime, and that's it. Just shut up, folks. The 24-hour news coverage is also traumatic for the victims. And I'm not necessarily always talking about, for example, the school shootings is usually a good example. And, personally here, actual food. First time in a year. Anyway. In And the part that I had problems with was when the school shooting started. Um, they were traumatic for me, extremely. Columbine was 4 years, 10 months, almost to the hour later, and that is not a coincidence, people. It just isn't. And for me, having after I wanted the therapy at first, yes, absolutely. It made sense to me. But you know, a shell shock, you know, um, you're stuck emotionally. You're reliving it, and I think when people have those flashbacks, and the kindest thing you do is you pop them with some Ativan. I'm sorry. Sometimes you need to shut somebody off. I don't mean obliteration. No. What I mean is you treat them gently and you fucking be nice to them. Excuse my language. Um, but in all reality, I think everybody has something in their health area where they find it a challenge to function. For me, it's being stuck in a hospital with no way out. When I was witness that shooting, I was one of the quote walking wounded. I wasn't shot. I came damn close. I almost took a bullet to my brainstem. And I was seen at a local hospital, and basically I was given some Ativan, and I think that was entirely appropriate. You know, and almost right away, I began having issues with ulcers. No kidding, and no kidding. But what ended up happening was a very vicious cycle. The antidepressants and those caused agitation, and the gut issues just never stopped. As long as I was on that stuff, it just kept getting worse and worse and worse. But the gut issues, the abdominal pain almost never stopped. It was miserable. But, whatever caused it, I think is not quite as important, really. What I think, though, is that it definitely caused a lot of those issues. I think the ones that dry you out, typically it will be the atypical antipsychotics. Now, let me make a note here. For some people, those medications are a blessing and a miracle. I had a patient in one of my clinicals that, she had been in a hospital, in a psychiatric hospital, since about the age of 7. And she had a very bad situation with schizophrenia. Now, I think appropriately given, absolutely. Those drugs, however, were not designed for use of an entire lifetime. For some people, there's no other choice. That woman would have been one example, and I hope God watches over her, really. I feel the utmost compassion for people that are in that situation. One of my best friends, her daughter is another example of how those medications could potentially kill a person. I'm not going to give her name because she deserves to be remembered in a positive light. But over prescription of antidepressants, they gave her 4, and that increased serotonin. Folks, that isn't 1 plus 1, or let's say 4. 4 plus 4 plus 4 equals, 12. And, you get that serotonin going up, I just won't be depressed. Here's the problem. The girl actually, I believe, probably had a schizoaffective disorder, which means you can have a depression version of it, or you can have a bipolar version of it. And the problem is, she was misdiagnosed with bipolar, I think. This is just what I think. But her mother is also one of my best friends. So, this situation was not a good one. But really, I think, and then they added more medications, most of which also affected her levels of serotonin, which is not another, plus four, plus four. Folks, what that is, let's say she had 7 medications, which was the case, that affected serotonin, guys, that's a 4 to the power of 7, and what that does to a person's brain chemistry. And the potential side effects, it's sickening to think about. She was also well on her way, and her mother believes this too, to developing gastroparesis. That is not something I would wish on anyone. I mean, really, it's frightening to me, because I think these drugs cause it. And gastroparesis, it puts a lot of people on nutrition support. A lot of them. Me, I'm blessed. I have responded to these oils and this diet so amazingly well. I use the turmeric, and I think I'm just going to take this as medication because you know what? For me, it is. And, I was lucky enough to have a great friend who helped. We are on Facebook. Our group is called Healing Gastroparesis Naturally. And, anybody's welcome to put in a request to join. We just try to keep it positive, and we focus on using the oils. I think it's just been, oh, yeah, that does. It helps the bloating, guys. It really does. Anyway, what happened to my friend's little girl, well, she wasn't so little, she was 37 when she died. And it was, even the coroner just basically said, yeah, it was what they called it was a polypharmaceutical overdose. But the implications here, I think people didn't take into consideration. Automatically, mom kind of goes, oh crap, what did I do to contribute to this? And the answer is nothing. And the doctors poisoned that girl. Maybe not intentionally, but I do believe they need to be held accountable. Would I like to cough their names up for you? Absolutely. But the problem is, you put the patient on trial. And, in 2007, I was being treated at a local hospital, and a lab technician came in to draw my blood. And unfortunately, this guy was the only one who could hit a vein on me. My veins are terrible. That is why I now have a central line. I called that one growing a brain. I hate being stuck, and I'm not a pincushion. And that's one stick and it's over, guys. It's actually quite cool. But I don't advise going and asking a doctor to put in a central line. I really don't. Anyway, I think that, generally speaking, I'm losing my train of thought. I'm tired. It's late, so, anyway, I was being treated at a local hospital. This guy comes in to draw my blood. He knew I was there for a psychiatric evaluation. But you know what? Here's the crappy part. Most of it was caused by the meds. And I'll believe it to my dying day. But there's a lot of things that complicate that. A lot. Anyhow, I think that, for one, those drugs are why I don't have any teeth right now. They're being made. Now, I walked around for okay, I lost my train of thought there completely. I'll get to that in a minute. And this guy that came in to draw my blood, I'm going back to the situation, because we're talking about abuse in hospitals. It's running rampant, folks. Completely. This man crossed the line in a way that you cannot repair ever. Ever. The damage that people do when a provider crosses the line, and I can't tell you how many have crossed the line with me. It makes me sick to even think about. It really, really does. I just, I think, that, for one, um, this guy touched me in a sexually inappropriate fashion. And, I didn't think anybody would believe me. And when I went home that night, I was extremely upset. No kidding. But I even had a cop ask me what the problem, what was wrong, and was there anything that I needed to tell him? And I said, no, I'm fine. I'm in a lot of pain, but and they didn't give me anything. But really, I just want to leave and go home. No kidding. I wanted to be somewhere that I felt safe. And I ended up going to a psychiatric unit a few days later. And I don't find that terribly shocking. It's called being a human being. I think it takes more courage to ask somebody for help and really work on stuff. But here's the thing. They gave me a bunch of medication. It basically shuts you down emotionally. A lot of those drugs keep you stuck completely. And I think that truthfully, it really, I don't know. It's ow. It's really hard to describe what it feels like to have been in a mental fog for so long. And then what tends to happen is that people say, oh, this is for life. You have to be on those drugs for the rest of your life. And, if somebody's functioning within their home and they're doing okay and they can live with it, freaking leave them alone. You know what? Sometimes for somebody, the quality of life is not being shut down all the time. Now, for me, obviously, one of my biggest fears is going to be trapped in one of those freaking places with no way out. No kidding. I've been sexually assaulted in one. I've been, shot at. Now, really, that is out of the ordinary. And guess what? I tell these people about it. They tell me, well, go screw, basically. And I said, can I please have something for anxiety? Then they label me a drug addict. I got 2 words for you. And if I'm going to publish this video, I can't repeat them. But I think most of you are creative enough to figure that one out. And oftentimes, and I don't qualify for Medicaid transportation. I make too much money at $9.21 a month. Oh, please. My bills are higher. It's just another set of problems, people. Seriously, my rent is higher. I get no assistance on my electric bill. And, honestly, it's like, please. And the destruction that these medicines have done to my body, it makes me want to barf. And the fact that they rotted my teeth completely. They were black. All of them were abscessed. Folks, I got news for you. One abscess will kill you. In September 1st of this year, 2013, a man in Ohio died from an abscess. Couldn't afford the antibiotic. The pain medicine was cheaper, so he got that. It cost him his life. And you know what? The problem was, yes, there were some psychiatric symptoms. You've got chronic inflammation and swelling 2 inches from your brainstem. Hello! It's not rocket science. When somebody's like that, you remove the cause. You don't shut them down with psychiatric drugs because it's not a psychiatric problem. What it is it's creating a neurological one. What you do is you treat the problem, not the symptoms, you idiot. And I'm sorry to put it that way, but you know what? It changes absolutely nothing. It means that I'm right and they're wrong and people don't freaking want to admit it. But, I'm the one that suffered. And you know what? It went on for a year, during which I'm denied antibiotic that I was practically begging for. I was in more pain than I've ever been in my entire life. What it also did was it's caused some severe anxiety problems that I still have. And now I have no choice. I have no freaking choice in the matter. Because now, when the anxiety gets so bad that I can't function, yeah, I do need to take something. And it's a struggle every single freaking day. And, being misdiagnosed with bipolar, stuck with a shitty label, you know what? It excuses nothing. It gives nobody an excuse to treat you like crap. None. And I say that as having been an RN, and I say that as having been on the other side. It is not acceptable. I would have been disciplined by both my employer and the state. Probably lost my license. Now that idiot phlebotomist lost his license. The genius who went in and shot up a hospital, yes, was shot dead on the spot because he was headed for a housing complex next door. The reaction I had makes me a human being. Period. It doesn't mean that there's a disorder, folks. It means that you're having a pretty freaking normal reaction to a very abnormal situation. And that doesn't mean that there's a personality issue. Are you freaking kidding? Telling somebody to move on with their life 2 weeks afterwards. That person was a mental health worker. Great. I tell another doctor, you know what? I'm not comfortable in a group setting right now. She says, well, you know what I do? When people tell me that, I put them in a group. I'm like, go screw, lady. And she was an Air Force doctor, big shock. But, doing that to somebody when they say no, I'm sorry, but no means no. Means no, means no. Okay? And, my family trying to tell me I have no right to not take most of those meds. I have every right to say no. I have a constitutional right to say no, and I have a personal right to say no. It doesn't make me a psychotic. It doesn't make me a lunatic. It makes me somebody who wants to function normally, who wants to, let my gut function normally for a change. You spend 20 years being tried out and constipated as hell, and getting every shitty label thrown at you like drug addict, mental, lunatic, bitch. You know what? One person can only take so much abuse. And, people that are severely mentally ill take even more of it. You show any reaction, and it's like, crazy, let's put her in the loony bin. You know what? I do have a right to tell you to go screw. It is my life. And if somebody's unhappy, angry, pissed off, try asking them what's wrong. Try treating them like a human. Try behaving like one. The behavior that I hear about from my friends and from their, from common friends and so forth, it's shocking to me. It really is. And really, most of the time, the reason I don't come out of my house very often is because I can't stand most people I meet. I'm sick of watching people be crappy to each other for no other reason than that they can. It gets old, and you get sick of dealing with it. Am I agoraphobic? Probably. I'm also worn out and tired. I live with chronic pain every single day of my life, and I will until the day that I die. And my reflex sympathetic dystrophy was actually indirectly caused by meds. RSD literally feels like you're being burned alive. And it sucks. But here's the thing. Burning in hell sucks. I don't recommend it. What happened to me last year was my miracle. And I realized that I could stay burning in hell for an eternity, or I could wise up and stop following a person and chasing a man who is not going to show love for the daughter that loves him more than anything. You stop following that and you follow God, and you find much more happiness, much more satisfaction in your life, even when the work you do is for free. I'm still a nurse, yes. What I do is I help my friends out. I provide them with information to empower themselves, hopefully, that they will use well. And I find tremendous satisfaction that I always love patient education. That's a favorite part of my job. Teaching people how to be independent, how to take care of themselves. You know, if somebody is happy with drinking coconut water because it soothes the nausea, you give it to them. It really is not that complicated. You know, taking this crap, having to use a med set to keep all that shit straight, it's ridiculous. You know, they even have to make them. You know, but if some of the things that I've seen recently in medical literature, it scares me a little bit. You know, 10 ways to ditch a problem patient. You know what? If you're publishing that, the patient is not the problem. The problem is the provider. You know, you sit down and you meet with somebody and say, okay, what's going on that you're showing up, etc. You know, you treat them like a human being. You know, if they break the law in your office, intentionally overdose after you tell them, look, you know what, this is enough. And that's a little different. You know, yes, some people earn getting discharged from a practice, you bet. But if they get upset after an appointment with a provider, you know what? If they're issuing letters like that regularly, I think the problem is not the patient. People need to stop blaming themselves. The problem is that that crap is published to begin with. Period. I blog on Blogspot. It's letters to the doctor from your problem patient. You should be able to find it with that search. My last entry, I think, speaks to how I feel. And you're welcome to check it out. But basically, if people get treated badly long enough and enough times, they are going to want to come back. They are going to want to have anything to do with you. And when patients are having the feelings towards a provider that cause them to lash out, guess what? You got a bigger problem than I think you realize. You're creating it. And, you know, as for my friend's daughter, what happened to her, I think it's murder too. May not have been intentional, but the girl still died as a result of the actions of somebody else. And I'm sorry, but I think after studying criminal justice as well, it is murder too. And in my mind, it always will be. As for me, what caused my reflex sympathetic dystrophy? I took prednisone to relieve back pain and some asthma. I was being an idiot and smoking. I quit 5 years ago, thank you. I'm not totally stupid. I get treated like it quite frequently. However, it led to a disorder called avascular necrosis, now present in every joint in my body, including my back, which means the RSD is also in my back, and that is a crushing pain, and it doesn't get any relief. It doesn't stop, folks. Nothing stops nerve pain. I got news for you. If somebody is claiming to be completely relieved, they have a worse problem than I think people realize when you induce your own suffering. But anyway, the avascular necrosis in April of 2011, I underwent a right hip core decompression to try and save the joint. Now, the joint is okay, the rest of me is not. And, do I wish I had never done that? No, actually. In spite of being in the constant pain that I am, and the people that I have met since then have changed my life, and that is not something I would want to miss out, because it has changed me for the better. You know, largely, I'm pretty functional without a lot of crap in my system. I take medicine for anxiety, and it's bad anxiety. You know, after having walked around with my face like that for a year, and the infection I have in my neck right now freaking hurts. You know, I really believe that much as I hate to say it, I think the medical profession causes a lot of this stuff. You know, maybe not intentionally, no. But you know, the RSD and the gastroparesis can also frequently go together. But anyway, within a couple of weeks after my surgery, now ketamine was given in my general, and I think that delayed my reaction to the surgery. And you know, ketamine could be a touchy issue for a lot of people, but it's helped so many people that I know, and it's helped me. And if a person is saying, I prefer a class 3 drug, and here, take the opiates, and they suck, I think that's a good thing. Now, the origins are a bit disgusting, yes, but it isn't Premarin, which, by the way, horse urine, that's a bit gross, folks. You know, but it's a touchy issue, yes, absolutely. And you always use it with care, and that's why I actually support the low-dose infusions right now. You know, for me, yeah, I'm a bit anxious about the whole thing, but and my hope and my prayer is that I can get out of the state of Washington, though I've been getting great care at the pain clinic where I go. You know, and they restarted that medicine for me, and I'm so grateful, because I want to give the rest of that crap back. I hate it. I hate it. You know, when it's the psychiatric drugs that ruin my life, and it's what people are trying to shove down my throat, it makes me want it even less. But I hope people will at least learn from what I've been through, and I think that's why I've started doing these videos. That, and I can't freaking sleep. But when chloral hydrate being what the one thing that I've responded to, I'm not sure I want it. Thank you, folks. But, you know, oftentimes it's the actions of other people when they're inducing their own suffering. You know, ketamine has gotten a bad rep, I think. Probably because, you know, of the origins of it, yes. But also, you know, people were mixing it with a lot of other meds. and abusing it, which hurts people like me. And you know, I wish them the best, but you know what? This being my prescription. When I called a couple of the compound pharmacies to look at potentially getting some cream or the nasal spray, except for out of the three that I called, one treated me decent. They're hired because they also had the best price, $56. Pretty cheap way to feel better, isn't it? And I don't have it. The reason is that people that I thought really cared about what happened to me are trying to obstruct my treatment. And the problem is the system where I'm at is not set up to manage a patient like me. My problem isn't that I don't have a place to go, because I do. Somebody I care about opened her home and her heart to me. And the one thing that I'm missing is a way to get me and my stuff and my kitty cat to California. I live in Washington State, and it's miserable. I hate it here. I don't hate it in this literal sense. It's a very strong word. But after what happened in that sexual assault, you know, when I have to go in for fluids, what I get is treated badly, with open hostility, crappy labels, drugs that I don't want. In April of this year, I list prednisone as an allergy. I've requested that my pharmacist locally and not even dispense it, and my file was flagged. And there's nothing worse than watching somebody put something that you react badly to. And I do get a psychotic reaction to prednisone as well. So the doctor that spent all those years prescribing that drug for me is also one person that kept me sick. Thank God she went into research. I hope like hell she reads it. But that person gave me not just Solumedrol, but Decadron as well. Two of the strongest IV steroids you can get. Now that may relieve pain, but it costs more. You know, I spent 2 months paying for it while that crap got out of my system. And when I had to be treated again because of their screw up, guess what I got? Yep, treated badly. And I guess I'm speaking out because nobody's going to do it for me. The lawyers don't give a crap, and few others do. And so here you go. I'm going to dump a name for you because you know what? I'm tired of being stepped on. Providence Hospital, Colby campus in Everett, Washington is dangerous. Oh, guess what? They are. I have a friend that had a jejunostomy tube fall out. It happens. I'd seen it happen in patients that I was taking care of. It's not anything that anybody did wrong. Usually those tubes aren't terribly secure most of the time. Her tube fell out. Those people tried to shove it back in without benefit of anesthesia or pain medicine. That's wrong. Think of anesthesia as a service that you have to request, folks. Sad fact as it may be. I think my disillusionment with the medical provision can be thoroughly understandable. You know, and I have a right to say where I was raped. I haven't exactly dropped the name of the offender now, have I? But, you know, I think it feels good to not be stepped on. And the hard part is people that I'm related to are the ones that are doing the most of it. And hard as that is to say, it's worse to be right. Anyway, I guess my video therapy session is coming to a close because I'm getting tired and I have a headache. And so anyway, know that you always have rights as a patient, as a human being. However, if somebody screws up, you know what? Sometimes there's more peace and forgiveness than there is in outright hatred. Because it's just going to eat you alive. Strangely enough, the hospital that did the surgery where I got my RSD is the one that I actually prefer. Given the other options out there, folks, I don't advise it. Survive a hospital and don't freaking go. I think that is what it boils down to. Hire a naturopath, smoke some weed if it's legal, and it's kind of a free-for-all, so good luck, everybody.